Hello, everybody, and welcome to today's presentation on patient privacy, confidentiality, and HIPAA compliance. I'm going to be your presenter today. My name is Dr. Lynn Klima, and I'm the Patient Safety Officer for QAPIplus. Just a disclosure, QAPIplus or myself do not have any financial interest, relationships, or other potential conflicts with respect to the material which will be covered in this presentation. Like I said, my name is Dr. Lynn Klima. I'm an adult nurse practitioner with over 40 years of experience across acute care, primary care, and community-based settings. Over the last 12 years, I've worked in an academic associate nursing, in an academic role as an associate professor of nursing, with a teaching focus on nursing leadership, therapeutic communication, community health, geriatrics, and hospice palliative care, both at the graduate and undergraduate level. I'm currently serving as the patient safety officer for QAPIplus, PSO, and I'm also an associate professor at the College of Nursing at the University of Olivet. So our objectives today are to recognize the laws on privacy and confidentiality of client information under the HIPAA, Health Insurance Portability and Accountability Act. Also looking at identifying potential consequences of breaching confidentiality, and then discussing strategies for maintaining patient confidentiality in various healthcare settings. So we're going to cover quite a bit today as we go through our materials. All right, so the very first thing to kind of all get on the same page with is our requirements for regulatory compliance around protecting patient information. So in this grid, you can see that our goals are to stay informed on regulations, implement compliance policies, provide staff training, conduct internal audits, and maintain detailed documentation. So, what does this all mean, and how do we, move forward with assuring that we're meeting those regulatory requirements within our organizations? So, when you're thinking about staying informed, these regulations change on a regular basis, and um, really, we're looking at both the federal, state, and local regulations that govern the services that we're providing in home care and hospice. Around those regulations, the expectation is that organizations have pretty comprehensive policies to assure that we're adhering to those relevant regulations and that we're preparing our staff so that they are aware of what those regulatory requirements are and how we're enforcing or becoming compliant within our own organizations. And then we're also expected to just really pay attention to or do an assessment of how we're doing. Or do we have any gaps in our performance? Are there opportunities to improve? And then along with that is we have to validate or justify or substantiate that we're doing these things through the way that we're documenting, not only through our policies, but also how we're assuring that we are adhering to all of these compliance regulations. So if we're doing training, if we're having staff, review policies, if we're educating our our staff on how to ensure that our patient records are safe, we have to have that documentation all ready and available to go should we have a survey or an inspection related to our compliance standards. One thing that's important to note, based on where we're working, is that in order for home care and hospice to be paid, we need to be certified by Medicare and Medicaid so that we can get reimbursement for our services. So CMS, Centers for Medicaid Services, have what they call the conditions of participation. So in order for us to be able to, be certified by Medicare and then be able to bill for services that we're providing, we are required to have processes in place that are ensuring that our patients' rights are protected, including the right to make informed decisions about their care. So, that's really foundational to the discussion that we're going to have today is, well, how do we do that? How do we approach that? How do we assure that we have systems in place that are going to, improve or maintain or protect that information? So, just as a reminder, patient confidentiality isn't just unique to home care and hospice. It's a fundamental principle in healthcare that really refers to our ethical and legal obligation to protect a patient's personal health information. This includes any data that can identify the patients, such as their medical history, any results, any treatment plans, any personal identifiers that can connect that information to them. So that's really, a lot of what we're trying to protect, so that that information is not available to anybody other than who the patient desires it to be. So it's really crucial for us to, have a process in place and be aware of what those processes are, so that we can build that trust between ourselves, our teams, and our patients. We want those patients to feel safe and sharing information with us and having discussions with us about what's important to them, so that we can help them make the best determinations for the treatment moving forward. So when we're thinking about patient rights, it's also important to consider not only the information, but also consent, right? So what are they consenting to? And there's, the fundamental right for our patients is that they have the ability to access their health information. They also have the fundamental right to privacy. They have the right to being informed about the procedures and the information that we're going to share with them, so that they can make important decisions about how they want their health to be managed, or what direction they want to go in related to their health or their care. And they also ultimately have the ability to refuse any treatment. It's really their choice. And so our job as healthcare providers is to not only understand what's important to our patients, but we also have to respect and uphold these rights and ensure that, our patients have the independence or the autonomy and the trust in our relationship as we're caring for them. So when we think about right to access health information, that means for all of us is that a patient does have a right to obtain a copy of their medical records, and they can ask changes to be made, or amendments or corrections in that documentation, if after their review they're not agreeable to what we've written in their record. They also have a right to privacy and confidentiality, so that means their personal health information must be kept private and secure, and only disclosed with limited access to those people who need that information, or for the care that they're going to be providing. Really important is the right to informed consent. So, in order for our patients to be able to act on decisions around their health care, they need to be able to know specifically, right? Be really informed and understand what their medical condition is, what their treatment options are, what are those risks and benefits to their choices. And we need to evaluate that they really understand that. So before we give any services, that they've consented to them. And then again, just as a reminder, they do have the right to refuse treatment. In terms of confidentiality requirements, when you're thinking about the obligations of an organization to meet those regulatory requirements, HIPAA requires that we maintain that confidentiality of patient information and really only limit that access to those people who need it. We also are obligated to protect patient privacy. So that doesn't mean just the record, but also, any way that we're sharing information, or how or who, that we have safeguards in our policies and processes to protect the privacy and security of that patient information. We have to have processes or policies that address uh, who accesses that information and when, so that the information that's provided to staff or team members is based on the information that they need to know. We also have to have, or are obligated to have, a breach notification, which means if there's been a breach, if their information got out or was, released inadvertently, or shared without their consent or their knowledge, we have to let the patient know and the appropriate authorities if there was any unsecured protected health information that was released as a part of that breach. And there could be penalties, right, for our processes within our organization. So if we're not compliant to comply with HIPAA regulations, we can have significant fines and penalties for our organizations and for the providers involved. So we want to make sure that we're, aware of, and then adhering to whatever systems or processes our organizations have in place to be able to make sure, one, we're protecting that patient's information, but that we're also protecting our organization from any risks that they could face based on our gaps in how we're managing our data and patient information. All right, so we're generally going to talk a little bit now about just some considerations of where we provide care for patients. And many of us are, doing some level of care in a patient's home or a family member's home who's taking care of a patient. And we have to remind ourselves that it's important, even in these settings, we're still going to have access to sensitive personal and medical information. And so we have to think about how these policies and these regulatory requirements apply within this setting. It's not as typical as a hospital or a long-term care facility or a outpatient facility, right? We have some different challenges. And, again, just reminding ourselves that maintaining the confidentiality of information is really crucial to building not only those trusting relationships, but also ensuring their comfort and well-being is met because of that trust, right? They trust us, so they're willing to share more, and that they also believe and know that we're upholding ethical and our legal obligations. But we know that there are unique challenges that exist when we're working in the community. When you don't have those structured facilities, you have different people that are helping care for that patient. It could be family members, it could be outside caregivers, could be friends, could be volunteers from their faith-based group. We have people that are helping translate for them. They also maybe have family members who have that medical power of attorney that are decision makers for them. So it's just a whole different scenario where it may seem a little more casual, right, in terms of the people that you're interacting with and sharing information with. So as home care workers or people that are providing care in a patient's home or family member's home, we want to make sure that we're prepared for circumstances that come up and that we understand how the policies with where we're working at apply to those situations so that we're not at risk for breaching any patient privacy issues. So some of those challenges, and just want you to kind of reflect on these for a minute, is when we're working in doing visits at home, we're going to multiple environments. We're going to different locations. You might be going to facilities as well as patients' homes. So this diversity in our environment really, speaks to the lack of control, right? We don't know what we're walking into. We don't know what we're going to see on the other side. We don't know who's going to be there. And so this in and of itself leads to the potential for unintentional breaches of confidentiality, right? It's the unexpected, right? So just being aware of that, how we're going traveling and what we're going to be facing or seeing is a challenge, right? And so we have to be cognizant or thinking about, how do we approach those situations. The other is just the people that are present, right? So there might be a lot of family or friends that are around or other caregivers when we do our visit. And so, again, this could lead to oversharing of information or overhearing of sensitive information. So, again, respecting how that family is involved, but really who and how do they get information and how does that fit within the policies that we have in a way to protect that patient. And then when you again think about that environment, it's the space and the privacy that you have, is definitely impacted. You may not have the opportunity to find a place where confidential discussions can occur without being overheard. And family members don't always realize like they need to step out or they should step out, or maybe they can go upstairs for a while or outside or whatever. So again, just being mindful of those things that are could we are facing when we go into a home and thinking about how this all might, the pieces of the puzzle together. The other are, emotional and psychological factors, right? So when we think about our relationships with our patient, we, many of our patients are longer term patients. We are seeing them more frequently. We're in a space that's theirs, right? And so we have just a different kind of a relationship with them than you might in an emergency room or an ICU or an acute care setting. And so it's easy to slide into being a more casual conversationalist with your patients, right? And you might inadvertently share personal stories or details that with other family members or maybe about other patients that you see that compromise confidentiality. So again, being mindful of our relationships are very close, very important, very trusting relationships with our patients, but we have to still maintain that professional integrity and ethically uphold our obligations, our requirements to adhere to HIPAA. So being cognizant of that. And then stress and workload, right? Just the number of patients, the number of visits, how far you're traveling, the acuity or the complexity of the situation when you're caring for the patient, what's happening at the time that you're providing care for them. So these are also high stress environments, and that can also lead to lapses in judgment or oversight in following, any necessary confidentiality protocols. So being mindful of that. Technology, right? We can't ignore the role of technology in supporting our patients. We are, you know, uh, faced with using technology every day, right? And that's continuing to grow in the different ways that we use technology, whether we're texting, using phones, tablets, computers, um, iPads, whatever the devices are that are critical to the services that we're delivering are a risk for us, right? So, we're using those devices to, get information, transmit information, and so we have to be thinking about who can access them, where do we keep them? Have I signed out of all my browsers? Am I logged out of my, business account, or my work account, or my patient's record, right? We want to make sure that, we're keeping these things as close and safe as possible so that we're not losing them or leaving them or misplacing them. And we also want to make sure that we're securing the device in a way that the information that's accessible in there is not mismanaged in any way or people have access to it. The other thing to think about is internet connectivity, and this varies for all of us depending on where we're working or practicing and the availability. And so sometimes in our, need to be able to move forward or get things through things quickly, that inconsistent internet access might, challenge us or compel us to utilize maybe an unsecured network. Maybe we leave a patient's home and go somewhere more public to do our documentation where we can access the internet. Maybe we go to the next patient's home and want to wrap up our documentation there. Maybe we go home and, so these are, again, things that we don't often really think about are ways that can be, uh, opportunities that would, we need to be able to improve upon so that we protect that patient's privacy. Others are just knowledge, right? Our training or our knowledge or education of what our policies and procedures are, and our regulatory requirements are. So, we all get different levels of training regarding confidentiality practices and maybe our role, maybe depending on when we started an organization, maybe training in relation to when a policy took place or a policy change was implemented. And so that inconsistent application of policies and procedures can also create a gap. So if we don't know what's expected of us or we're not aware of the current expectations of what's expected to us, that can definitely lead to a risk area that we want to be, mindful of and considerate of as we're developing you know, our um, our plan around protecting patient information. The other is awareness of policies, right? So maybe we aren't as knowledgeable as we need to be. Maybe we kind of glossed over the training or just kind of reviewed something or were distracted when we were a part of a training. So we really want to make sure we understand what our organizational policy is around patient protection of information and confidentiality and how to handle protected health information in home health scenarios. So you want to be able to, know what your organization is expecting of you and how or what that looks like in your day-to-day practice, right? So there's reading a policy, but then there's also analyzing and critically evaluating, well, what does this mean for me in my day-to-day job? How do I do this? How do I implement this to assure that I'm being as safe and secure with that information as possible? All right, so continuing on, let's just really kind of review the basics here. So, in terms of maintaining our patient confidentiality, we're looking at understanding laws and regulations. We want to make sure we know what those are. We want to make sure that we know the process and that we're carrying out receiving informed consent and authorization. We're looking at how our or what our strategies or policies are related to limiting access of information. we have, and we're looking at and following the secure methods to make sure that our devices are protected, the data that we're putting into them, the access to the records that are there, and then the device itself so that it doesn't get lost or stolen or misplaced. We will also want to remember that we're respecting our patient preferences and their diversity, and we want to make sure that we're ourselves being knowledgeable about our own actions, our own work, and how we can, maintain and protect that patient confidentiality. So, some of the things that we have to think about are what are some of those best practices to help us with that. So we want our goal here is compliance, right? Making sure that we're protecting the information of the patient and being compliant with those regulatory requirements that we're all required to do. So the first is just education and educating ourselves, making sure that at our organization, if you're at that organizational level, that you do have regular training sessions on confidentiality policies that you've implemented, the importance of confidentiality, how you're, guided in terms of your accreditation and regulation around honoring those conditions of participation from Medicare and Medicaid. And then you're working on policies that support the staff in terms of how they can handle sensitive patient information when they're out in the field and wherever your clinical work is. So, ongoing trainings. One really great strategy that's in the literature that's recommended is to engage staff in role playing scenarios to emphasize the importance of confidentiality in real life situations. So, taking, you know, anonymous components from the field and building a case study and really talking them through and doing that more regularly, right? So that the knowledge that we're learning is applicable to the work and all levels, all staff understand their role in protecting that patient confidentiality as a valuable team member in the organization. The other is related to our, our documentation practices. So again, how are records stored? How do we protect that digital information so that we're not giving unauthorized access to other people who might be able to gain access to our devices. We want to protect those devices. We want to make sure that we're logging, have proper login channels and encryption so that your sign-on code is giving you access to what is important for the work that you're doing for that patient, but then also long term we're not allowing that information to be viewed or accessed in any way when we're not the ones that are in that patient's chart or record. If you do happen to have any paper documents that contain PHI, protected health information, you want to make sure that there's a process to either electronically dispose of them in a secure way or that they're properly shredded through a confidential shred system or box. And our goal here is to prevent those data leaks and have a data breach at all. And then one way to really see how we're doing are to schedule routine audits to really look at our documentation practices. What does that look like out in the field? Are people aware of policies and processes? So it's not just really a one and done kind of annual training. While that's important, it's also important to really kind of monitor how do people understand the policies? Are they aware of them? Are they activating them out in the field? And so these are great things to bring into staff meetings or team meetings to kind of look at data, talk about it, and then build some case study learning activities or simulations to be able to help people master their actions so that they can help maintain that level of security that is expected of us. And this is really an opportunity in QAPIplus, our software system to be able to, create audits like that and create a dashboard so that it gives you an opportunity for not only meeting accreditation standards, meeting conditions of participation, but also looking at performance improvement around a safety initiative or a confidentiality initiative. The other is, in terms of data, we have to think about our data, in a HIPAA compliant system as well. And so, as an employee in the field, knowing that the policies and procedures that are are in place related to your access to your emergent, your EHR, and all the files, related to patient records is related to the policies to assure HIPAA compliance, and that your organization is selecting, their or developing their policies and procedures for you based on assuring that we're regulating and monitoring this data on a regular on a regular basis. The other thing that we have to remember is our patients, right? So, what do we do to inform our patients about their rights related to confidentiality? And so, we want to make sure that, and again, this is where informed consent comes into play as well, is that patients and their families understand how their information is going to be used, the importance of data protection, and what we're doing to be able to do that, and what they can do to contribute to protecting their privacy too. Like, so making sure they don't leave, information out that they don't want to be shared or seen or viewed by other people that might be entering their home, or who should be present or who do they want present when we're working with them for a patient, visit and coming to, help them with their healthcare needs. So those are all important things to really, have in terms of the discussions related to how they can be involved in assuring their information is protected as well. One way that is, is universal is, a standard consent form that organizations have that patients are, are required to sign as services are started, that helps them, identify or know, what information can and will be used and what their rights are related to that. So not only are we asking them to review it and sign it, it's also really important to make sure that they understand it, right? And who on your team is the best person to assess that, right? And reinforce it and continue to go over it so that they connect that process to, what happens in the day-to-day actions with their information that's out there. The other thing to, that's really important as well for all of us who are working out in the field is really what are organizational policies and protocols related to communicating with our patients out in the field so that we're assuring that the information remains private. And so, when you're thinking about your own work, again, what we've talked about earlier in our presentation is really thinking about your job and the day to day to your job, and where are some opportunities to really think about patient privacy and confidentiality. And one is thinking about, when you're doing your visit, where does that take place? Who else is normally around? Who might be kind of coming in and out? And for a newer patient, you're just finding that out. And that can be a part of an assessment where you're discussing around confidentiality where they would like to have those conversations, which, certainly can change depending on their health and their health status and the changes related to that. But getting some sense of where that might be in their home or their location, and then who else, is okay to be a part of that, or that privilege of information. And again, our goal as those providers is to try to get have that relationship with them that assures that they feel comfortable talking to us, right? And so if there's a family member that maybe they don't want to overhear the conversation, or they're holding back any information with us, we kind of want to, alleviate that or prevent that from happening. So we want to make sure that we're trying to meet with that patient one on one and letting the patient, converse, for themselves and talk for themselves. We also, and this is one of those things that, we talked about a little bit earlier, is, who gets that information and sharing that information on a need to know basis. So this is, really important for us on our teams, within our teams, in our organization, but also in that environment where we're with the patient, right? And you're only going to discuss details with those people who are directly involved in that patient's care. You're not going to overshare or share information that's not prudent. And then making sure that we're using secure messaging platforms, right? That this is again where technology is out there, and what is that system that your organization has laid out for you for instant messaging, for texting, is it's not necessarily on the open platform, particularly when you're using, or sharing information about patients. It needs to be an encrypted communication tool, so that that information isn't inadvertently shared to somebody or seen by somebody outside of their care. Okay, so those are some of the ways that we can, kind of start to think about best practices for our patients. Now we want to talk a little bit more specifically about why we have HIPAA, right? And we're just going to kind of touch on this a little bit. It is a federal law that was, it is, a governmental regulation that sets the standards for the protection of sensitive patient health information. And they talk about, particularly as we've evolved even more into electronic platforms, is that the regulations requiring the following of HIPAA, again, touch on that confidentiality, which we've been talking about, data integrity and security, and how that electronic health information is protected. It is guidelines that all healthcare providers, health plans, and healthcare clearinghouses have to, or data centers have to adhere to, right? And then they expect that your organization is looking at those requirements, what resources and tools and supports you have there, and you're establishing your own privacy and security rules that are in alignment with those guidelines. So it's a comprehensive law, and the idea is to protect a patient's rights by helping their prevent their health information being shared inappropriately or breached appropriately. So this is just a kind of a brief timeline of when it started. So it's something that's not new, right? It started in 1996 and it continues, and evolves as we're, continuing in healthcare. And as we have even newer technologies, there's updates to HIPAA that, change the way that we practice within our organizations. In home care and hospice, in the settings that we're typically working in, a main part of any healthcare provider team's role is to, build trust with our patients and their families so that we can establish those relationships that are going to help them, get the best care that they can and feel like they're getting the best care. So, in terms of how this interfaces or building that trust relationship interfaces with these regulations is that really, kind of assures our patients that we take their data security seriously, and these are the ways that we're going to manage it. There's also, as I touched on earlier, some financial implications to, not only ensuring in an organization that they have the systems in place to, set up and adhere to the regulatory requirements, but they also have a risk of, legal fees and fines if they have a data breach and, can impact that. So we've already talked about secure data storage and transmission. We want to make sure, and this is really where I guess independent learning is important too. What are your policies? Do you know what they are? Where are they kept? And so those policies are really the core front and center of sharing with you or telling you or helping you understand how you should be, practicing to assure maximizing, confidentiality and data security, PHI, and with our patients, the in the best way possible. And, we also have to, again, do those regular risk assessments to assure that we're protecting that information. So, this is several of the different rules that HIPAA is, requiring us. There's the privacy rule, there's the security rule, there's the omnibus rule, which, really is how we, do business with all those other associates that are impacted. So, like maybe our DME company, our pharmacy company, all those other vendors that we work with and subcontractors, there are regulations about what that data is and how that data is shared. So that's a part of that omnibus rule. And then the enforcement rule, obviously, is the monitoring and establishing the investigation of complaints. So if you have a patient complaint, or you've had a data breach, so there is regulatory oversight to assure that we're, setting ourselves up to be able to have a safe and secure environment for our patient data, and they have a process to make sure that we're enforcing it. So again, three key principles about HIPAA are protecting that health information and making sure that we have safeguards in place to protect that privacy, security for all the data that we are collecting, so that it again remains unidentifiable and protected so that it doesn't get leaked. And then if we do have a data breach, whether that be with an individual patient or a group of patients or a practice or an organization, that's something that does need to be reported. And those are policies that your organization would would have in place. So now let's just think about, what kind of data we might see that we're collecting as healthcare providers in the field that we want to make sure that we're attending to as protected information. So the definition is, really individually identifiable health information, including their demographic, right? So if you can tie a patient name and their gender and their age to like where they live, their medical history, their past medical history, future concerns or, comorbidities, all those other multiple diagnoses they have, who they're seeing, if they're seeing a provider, who are all those providers, their financials, what are their billing information, what bills are due, what have they paid for, mental health services, access to mental health, and that has its own set of requirements in terms of what's protected and what's shared, and often are, independent or separate parts of a medical record that all staff don't necessarily see those records, substance abuse history. So even just acknowledging that a company is providing care to a patient. So if a patient calls and says, are you seeing such and such? Or are you seeing Mr. So and so? You can't even acknowledge that you are, right? You have to, again, looking at that omnibus rule, who are the vendors that are involved? What consent forms do you have on file? Why does this person need this information? But even, acknowledging, yes, that is a patient that we're caring for is giving out protected health information, because now you've just indicated, yes, this patient is under our care. Um, excuse me. How do we use that data? So again, that use and disclosure. A covered entity, which would be your organization, is permitted but not required to use and disclose protected health information without a patient's authorization for the following purposes. So again, there are situations where we can. So if we're giving information back to them about their care, um, usually in our consent documentation, it gives us permission to be able to share information regarding treatments and payments and healthcare operations for potentially like with an insurance company or maybe a subspecialty or a specialist group or a primary care doctor who's been, it's involved in the patient's care and we're their home care provider. If there's incidents to an otherwise permitted use and disclosure, so sometimes people can add on changes to that, public interest and benefit activities, and then if there are limited data sets for the purposes of research, public health, or healthcare operations. So, for example, if you were collecting a lot of information on falls or infections, you're giving maybe a report out of your data or your QAPIplus on how you're doing as an organization, but it's not tied back specifically to a individual patient and shared in that manner as a part of looking at data. So I've provided a link in here in terms of the summary of this HIPAA privacy rule. And again, this is a good place to go to see if there's anything that's new or updated. So when we're thinking about the patients, in home care specifically, a couple of permitted disclosures to think about are, again, if your patient's asking you information about, what you're doing or what the treatment plan is, or, the best way to develop a care plan, or who on the team, that's going to be coming to see them, and what the results of the findings might be from lab tests or a communication that you've had with the doctor. You're talking with them about their care, and so that's appropriate. Also to colleagues for treatment purposes, right? So if you're on a team and you have a care team, you might be communicating, with them about maybe a patient needs. Maybe you've identified a referral for the need for a social worker to come in, or a dietitian, or whatever resources it is. You're collaboratively, uh, you know, talking about their care for the people who would be relevant to their care, right? It's not somebody who's not necessarily on that team. And this is all generally a part of that consent that patient signs at the very beginning that says, these are the people that we're working with and they may be involved in your care. And then legally, and this is really where you're advised to contact your supervisor and organization for direction. But if there are any issues related to public health or law enforcement, that laws are dictating the need for information, like, for example, reporting abuse or neglect or endangerment situations, clearly you're going to be working with your team members to be able to adhere to the policies that are there in your organization to assure you're doing this in the right way, but you're also following the law, right? And many of times for us, it's related to patients that we're concerned about in their home situation, and how do we, share that information so that we can help them, right, in the best way. I really liked this graphic that I'm sharing with you here, and it's in the PowerPoint as well for your availability. But this is from the HIPAA journal. Yep, there is a journal out there called the HIPAA journal, and these are 10 steps to HIPAA compliance for home health care. So I think this is really helpful, which rules, so just kind of going through and which rules apply to your organization, who's responsible for assuring that privacy. So larger organizations might have a privacy officer, smaller organizations might have somebody is part of somebody's job description, maybe the manager, the regional manager. It might be the chief executive officer. So it depends on the size of your organization, but you should know who that person is. Who is kind of helping oversee this for us, right? You want to know that. The privacy officer is often, they also suggest a security officer. I think many organizations don't, unless you're a big system or connected to a big system, you often don't see two separate people. But you could also, a lot of times, an informatics, CTO or director of IT or manager of IT, oftentimes will be that security officer also, because they are, kind of helping us, with our EMR and our electronic data sites. So if they're definitely not the security officer, they're definitely involved. Determined what your PHI is. So what is your organization? How have they identified that protected health information? If you are thinking about your EMR, I think that pretty much covers protected health information. But there may be other things as well: lists, forms, reports, things that go out that maybe have a patient identifier on them. So you want to make sure that you understand what those all are. As a leader in an organization, you want to make sure that you have an audit in place, that you've done maybe a baseline audit to see how you're doing, right? And collaborating with that patient officer, security officer, and get some benchmark data, see where your opportunities are far in advance of, being survey ready, right? So we talk a lot about surveys in our line of business and in healthcare. We, also just want to be looking at, how we are in terms of meeting those regulatory requirements, and are there performance improvement opportunities there. So QAPI Plus actually does a really nice job of providing the ability to do audits and capture data and put it into a benchmark so that you can see those areas that are, important to be able to follow. Minimize and simplify your PHI, right? So sometimes we create these systems that are overcomplicated, that have a lot of data on them related to our patients, and it makes it hard to kind of track and monitor and assure that we don't have those things that are kind of getting in our way. What are the security rules, right? How do we talk about them and ensure they're front and center? Not only is it, giving education to everybody, but it's also kind of bringing it up regularly, kind of using your audit data, or maybe challenging cases that are in the field that you are aware of, that you can kind of bring and debrief with everybody in a private way, right? So you're not going to be able to identify the patient to the entire group, but you want to make sure that people know the rules and are using opportunities that they're seeing within your own organization to improve. Again, going from that auditing data, that's an opportunity to create measures and report not only how you're doing, but also a tracking mechanism if you do see any data breaches and how you go ahead and report those. And then what are your reporting exemptions to your state attorney generals? And then and so who's responsible for that? And then how do we keep up to date on those, any HIPAA changes? Who's monitoring that practice? Right. So those are some of the key things that we're looking at. So a couple of violations that just to start to be thinking about is in home health. One area that we talked about earlier is just that oversharing of family members, particularly if a patient's objected to a disclosure, right? So if a family member who a patient hasn't given permission to hear information, that's one way that we can violate HIPAA. Giving out more than the minimum necessary protected health information. So again, this is where your organizational policy will dictate what you can share. So if you're doing a DME referral, what goes out with that? Do we have a consent from the patient? If we have a someone contacting us for information about a patient, do we have a consent that we can give that information, and what is that information and why? And then, another example is disclosing protected health information on social media. And I think this is, kind of I think one that is really important for us to really think about. We'll talk about it here in a few minutes. Others that, are a little bit more unique to hospice is when you have volunteers that are a part of that team, which is, a condition of participation is, they're considered the same as employed staff members when it comes to HIPAA. So therefore, you need to have the same training on HIPAA policies and procedures as your staff. Volunteers are also subject to the same sanctions as professional employees for violations related to HIPAA. And, hospice personnel can discuss protected health information of a patient with an unauthorized member of the family or other individual once the patient has died, if the conversation relates to, services that were provided, unless there's, your disclosure of protected health information is inconsistent with the prior express preference of the person who has passed away. So again, what you share and how you share it is based on what the patient has given you permission for. And if that's not clear, then you have to be, err on the side of caution. The other thing with hospice is, in terms of really actually all of our agencies, if we're doing any marketing, fundraising, images or examples are, breaches of HIPAA unless the patient or their family or donor's name is used or their image is used or they have an appointed representative after their death has give informed written consent. So we just have to be really cognizant of how we share that information. And then even with memorial services, right? So a lot of times hospices will do an annual memorial on people that have passed away, and we have to be, careful of not releasing the names of those people without that written consent and of the family members or appointed representatives when we're doing those kinds of things. So we want to be, sensitive to that. We already talked about that. All right, so then let's think about examples of HIPAA violations. All right, so let's continue talking about examples of HIPAA violations and think about some of the experiences that we might have as we're going through our patient care in the areas that we work. So let's think about unauthorized access to patient information. So thinking about, being in the home and maybe your home health aide and you have access to the medical records of a family member that's receiving care from the agency that you work for without a valid reason related to the care, right? So when you're thinking about, if you're on a team and if it's not a patient that is assigned to you or that you're directly involved into the care of that particular patient, um, and it's a family member that you know of, right? You can't go and look at any of the information related to that particular patient to find out any information related to them, whether they're someone that closely in your family. You don't really have the approval to be able to go into their case if you don't have a valid reason related to their care. So this is a breach of confidentiality as it involves accessing protected health information, PHI, without appropriate authorization. So be thinking about that, right? If you live and work in a community where you might be, providing care to people who you know or their family members, friends, or relatives, you can't go and access that record to be able to look at anything related to them, right? If you're not directly involved in their care. The other is inappropriate sharing of patient information, and this is really one of those traps that I think is easy to kind of slide into. So it's important to be aware. So maybe, as a, care team provider or nurse, you're talking about a patient's medical condition with friends on public social media platform, mentioning specific details about the patient's diagnosis and treatment. And that I've seen that happen, right, where people get frustrated with a case, or they are sad about a case, or there's something unusual about a case, and they'll go ahead and they'll post that. On Facebook, Instagram, texting between each other. So, again, this is a breach of, sharing sensitive information without a patient's consent violates those HIPAA privacy regulations, right? We don't want to be able to, catch ourselves in those positions. Other is example would be negligent disposal of patient records. Patient files that contain protected health information are found in a dumpster instead of being shredded or disposed of securely. So, thinking about if you're cleaning your office, cleaning your car, cleaning out your briefcase or your patient visit bag, do you have any information in writing in there that, is protected health information? And you just toss it in the trash somewhere, whether it be in your office or at home or even in a public location, right? So most organizations have access to shredding bins that are secure places to be able to dispose of that information, or you'll have an organizational policy that directs you, what you should be doing with that documentation. So leaving protected health information in an unsecured location can lead to unauthorized access and is a serious breach of confidentiality. Another is failure to secure electronic devices, right? So a scenario might be that a home care worker uses a personal tablet to access patient records and leaves it unattended in a public area while on a home visit. That failing to secure that device that contains that protected health information puts us at risk of, that information being accessed by unauthorized individuals. So, like we talked about earlier, protecting whatever devices that you're using the devices that you are assigned through your workplace with that encryption to be able to access it, and making sure that that patient information isn't left up on a screen or browser or accessible to other folks. Discussing patient details in public. So during a lunch break, maybe we're talking about a patient case loudly in a public cafe, a conference room, not realizing that others can overhear their conversation. So again, not disclosing any talking about our patients in these public spaces, breaches confidentiality and HIPAA regulations. Also using unsecured communication channels, right? So sending patient information via an unencrypted email to a colleague instead of using a secure communication system. So our organizations have policies and procedures about how we share that information, how we communicate with each other across teams and with vendors related to patient scenarios. So we don't want to use unsecured methods to share that patient data, because that increases the risk of that data being intercepted, and it represents a violation of the HIPAA security rule. Training, so inadequate staff training. And I would also, in this, think about staff attending training, right? So you want to make sure that all staff members have access to adequate training on the compliance regulations around protecting patient information, and how they are guided in terms of what and where and how they can communicate, so that there's the ability to make sure that they understand that training. So, maybe people in your organization aren't aware of your compliance policies and inadvertently are discussing patient information with, with someone who's not part of the care team. So if you're seeing this, again, this goes back to that surveillance or that monitoring or that assessment of what you're seeing in your organization in terms of your opportunities for improvement. And a lot of it is training. And from the training side of it is participants in training. It's also making sure that you're attending to your training needs and participating in the trainings and bringing up questions and issues that you have if you're uncertain, right? Going back to your manager or your team leader and asking for guidance and support. So you want to make sure that you know what's expected of you and that you're participating in those things that are going to help build your knowledge and confidence and how to appropriately carry out those regulatory guide policies as expected. Failure to document consent properly, right? So part of all of our process to, really be able to get all that documentation in our records as we're providing care to patients, it's important to be able to, get the proper consent from the patient before discussing their condition with a family member, relying on verbal agreement without documentation. So again, when we're working in patient's home, we're going to be interfacing with a lot of different people who might be visiting that particular patient in their space, right? So we want to make sure that we've received written consent, from that patient. Maybe we get it verbally, but we have to follow up to make sure that we're getting the documentation to know who we can share that information with and what information we can share with them. So that documentation of consent is really important in terms of assuring that we have, completed it. So those all those forms and papers that we're getting as a part of our admission packet, you know, um, outline that, but then we also want to, make sure that we're following up with, who are those people within that home environment or on that care team that we can share information and what information we can share, right? That protects us, protects the patient, protects their privacy. Improper handling of that patient information. So another scenario might be that we're printing records and leaving them unattended in a vehicle while making a home visit, exposing them to potential unauthorized access, or even on the printer, right? Thinking about documents that are left on a printer that we might be making copies of for various reasons, or things that we're leaving in our vehicle or in our bag. So leaving that hard copy, that physical documentation containing anything related to that PHI violates that confidentiality requirement under HIPAA. Also transmitting PHI without encryption, right? So again, we're using, our personal email accounts to send patient health information, which doesn't have that encryption, right? So we have to use our work email, the processes that we've been told to use within our policies, and that's going to vary by organization and what those login and those encryption requirements are. This one of the reasons why we have those new login requirements that they expire within so many days that we have to go back in and create a new login and new passcode. So again, this is a violation if we are transmitting protected health information without appropriate security measures, and it exposes patient information to potential breaches, which violates those HIPAA requirements, right? So you want to make sure that you're doing this in a way that is, within the standard and the protocol that your organization has outlined for you. So organizations are required to have those processes in place to assure that security is there, but as employees, we're also expected to know what they are. And if we don't know, that's an opportunity to clarify with our leadership or our manager so that we can understand our role in protecting that information. Some social media tips. It's very easy to slide into the habit of you know you know complaining about our day, or outlining in a social media way things that maybe frustrated us or made us unhappy or made us happy, whatever the circumstances are. That social media is a big risk for all of us in roles that are caring for patients. So just as general guidelines, don't talk about anything work related in social media. Don't talk about patients, coworkers, even in general terms, right? Because if people know where you work and maybe you live in a community where it's smaller and people know each other, you don't want to risk any sort of a data breach or people thinking your organization or where you work allows you to be able to, talk about patient cases that, you know, just erodes that trust related to that organization. Don't mix personal and professional lives on social media, right? So think about social media as just, personal. If you're using it it's for fun, it's for connecting with your family, don't even bring your professional space into that social media platform. Never take a picture of a patient, even with your phone, without assigned consent. This is just really even not a good practice to do, even if a patient agrees and wants to do it, right? Like, kind of have some hard and fast rules for yourself so you don't put yourselves at risk, right? And then know your organizational policy about social media. You want to be really, cognizant of what's expected of you and what you should be doing or shouldn't be doing around that social media space. So in summary, we've talked about some examples here that easily violate, shows how HIPAA violations can occur in home care settings. Often, due just to our oversight, right? It's more, can feel like more of a casual patient relationship interaction when we're not in a facility and have some of those facility guidelines that protect us and remind us. It could be lack of training or understanding or training, or just, pure people's choice of saying, I'm just going to do this anyway. So we don't want to be negligent in our actions. Our the people that we work for, our organizations, need to be cognizant of what kind of training they have available to new staff and routine staff, and that they have training that assures that there's updates provided and opportunity for retraining should policies or procedures change, what those security measures are and why we have them and how they're protecting people, and what we're doing to ensure not only the employee is protected in the way that we're using these policies, but ultimately it's protecting the rights of those patients that we're taking care of. So, when you're thinking about your organization and some of these best practice, just again, be thinking about what your training is like at the organizational level. What do you have in place? How are your staff attending? Staff, if you're a staff member like I am, am I participating? Am I fully engaged? I mean, I know we all feel burdened sometimes by those annual competencies that we have to go through, but there's a reason for it, right? We're trying to remind ourselves and be updated with, an opportunity to learn and reflect on how we can improve our practices. Making sure that you do have an assessment, right? What are those regular risk assessments that are taking place in an organization? Who's responsible for those? How are you doing? What are your benchmarks? What are your opportunities for improvement? Um, you want to make sure that you have, based on those audits, you have access controls and audit logging. So again, this is, more of that IT and safety officer sort of evaluation. What are our processes for accessing the electronic tools and technology that we have to be able to communicate across our teams or across team members, and how are we doing with that? Do we have access to electronic information that's based on our roles and our logins, and how's that monitored and evaluated and updated as needed. One thing that is, important here, and again, I would think that, in QAPIplus, if you're using QAPIplus software, there's an opportunity in there to be able to look at incidents, right? So we look at patient complaints, but we can also look at our own internal monitoring. And so, are we documenting any incidents with data breaches that we might come across in our daily practice? And again, this is part of staff's roles too. Are you seeing a data breach in the field, or is one that you think that maybe you put yourself at risk for, or you overheard, or you saw? So capture those incident reports so that an organization can start, as a part of that auditing plan, track and trend those incidents as well. And so we sometimes think about incident reports as negative things. They really are an opportunity for us to catch and be proactive around identifying our risks early on so that we don't, discover a data breach that, was really something we saw in the field, but maybe there's a trend going on. And then the other thing, and this is really related to again, at the organizational level, what is your data backup plan and disaster recovery plan, right? So you want to make sure that patient data is regularly backed up and secured, and there's a plan in place to be able to restore operations in the event of a disaster or a data breach, right? So there is a significant electronic data breach. Sometimes places will shut everything down and go to a paper process. So, what is that plan? That there is a plan. You don't want to be figuring that plan out in the middle of a data breach or a data shutdown. You want to have that plan in place and that people know what that plan is, right? A well communicated plan is only going to help with overall success in terms of recovery efforts when you have to get back online, and how does business go on moving forward in the most protected way possible while you're recovering from that data breach. Organizational resources. So again, as a staff member, it's important to know who's responsible for privacy in our organization. Maybe you are large enough that you do have a privacy officer or security officer. Maybe it's a part of somebody's role. That's more often the case in outpatient areas. And so finding out who is that, how do you reach them, how do you contact them, what's part of that process, where are the policies and procedures, how do I access them, how do I have the availability to find them if I'm out in the field and be able to look at them if I have a question about something. Who should I call if I have a question about something? And then what training do you have on an ongoing basis? And if you have questions about your training too, right? Like if you feel like you need more confidence around handling a patient situation in the home, how do you bring that to your manager's attention and that gets incorporated into ongoing training or discussion or field staff, supports? And I encourage you, if you have stand-up meetings, if you have huddles, if you have, some time around your interdisciplinary rounds, is there a way to add on some additional training and support around protecting patient information so that we all get more confident? So again, policies that we should have are around privacy, compliance with regulations, how we communicate with each other, what our timeline is for policy review. Are we reviewing it every year? Is it every 6 months? Like what that is at the minimum, it's one every year that's expected. What is our policy around employee training, and what does that look like, and how do people access that training? And a lot of people have gone to electronic training platforms. Some organizations do live trainings within their staff meetings. I mean, every organization approaches it differently. The main thing is that you have a policy and you're adhering to your policy, and your policy is attending to these HIPAA regulations. And that are data security. So, what are your policies around data security and access and those kinds of things? It's important to also know that, if we identify a breach or if there is a breach for privacy that's, identified, there is a response that needs to take place, right? So the first is identifying the breach, and whoever identifies that quickly assessing it for the nature and scope of the privacy breach. So, for example, if you're, a home health aide or a nurse in the field, staff member in the field, and you've identified something that you are concerned about, you may not be looking at the entire nature and scope of that, but you certainly want to bring it to the attention of your manager or administrator, who then is directly responsible for evaluating and identifying how big of a breach that is. So whatever your role within an organization, if you come across something that you even remotely consider as a breach, you want to bring that to the next level's attention so that it can be investigated. And generally, these are co-collaborative assessments between departments to be able to really assess what's going on, get to the root cause of it. You want to, and part of that is also to contain the breach, right? Take immediate action to stop the unauthorized access or disclosure of personal information. You want to notify the affected individuals. So again, if there's a patient or family that information was compromised, you're going to want to let them know. You're going to then, investigate the incident to conduct a thorough investigation, understand how the breach occurred, and to identify that root cause. And then the goal here is to mitigate the harm, right? Implementing measures to minimize the potential harm to affected individuals and prevent further breaches, right? So it's a very comprehensive approach to being able to, to do that. You also, as a part of that, might need to report to authorities depending on, what level of breach it was once you've done that investigation, and then implement a corrective action. So that action might be with an individual, it might be with a team, it might be changing process or policies, it might be, broader than that related to, electronic data and communication plans, right? So the idea here is that you have to change it, right? You have to fix whatever happened so it doesn't happen again. And then you use this opportunity really to just do a review and learn, right? Like, what did we learn from this? And, we want to evaluate the changes that we have made based on the breach to make sure that it did its job, right? Like our response to this was effective, and we feel confident that we are not going to, be in this place again. So, just again as a recap in terms of thinking about training, for what we should be including, we want to make sure that we're not only looking at, our compliance regulations, like what's required for HIPAA, but then what are those protocols and how we're, connecting the two of them to assure that our staff know, and everybody across the organization, and even guests that come into our organization, right? So if you have, like we talked earlier about volunteers, but if you also have students or guest staff or staff that are coming in, maybe from an agency, that all these staff, and it's not just staff in the field in terms of clinical staff, it's anybody in your organization who is going to interface with that patient's record and patients and families directly. They want to be knowledgeable about how they can protect the patient's information as well. So let's just kind of walk through a case here as we go through this. This is Mr. Thompson, and he's a case study, right? So one day, a Green Valley Home Care Service employee, a home health aide named Sarah, was assigned to care for an elderly patient, Mr. Thompson, who had recently undergone surgery. During her visit, Sarah learned sensitive information about Mr. Thompson's health condition, including complications related to his medication and his recovery timeline. So after the visit, while waiting for a public bus, Sarah engaged in a conversation with a friend. During this discussion, she shared details about Mr. Thompson's health issues and other private information, mistakenly believing that her friend could not hear her. Her friend could not hear her. Unknown to Sarah, another passenger on the bus was a neighbor of Mr. Thompson who subsequently overheard the conversation. So the breach notification was the neighbor was concerned about the breach of confidentiality and contacted Mr. Thompson's family, and they immediately contacted the home care agency to report the incident. The agency conducted an internal investigation and found that Sarah indeed had discussed details that violated HIPAA regulations as patient information had been disclosed without consent, right? So the consequences here were, really kind of looking at, three avenues. One for the employee, the leadership, Sarah's, managers, you know, worked with her related to her actions, which in this case, based on their policy, included a temporary suspension pending further investigation. So organizations, do have policies around, what happens with individuals and what the implications or the consequences of those data breaches are. She underwent additional training on HIPAA compliance and the importance of maintaining patient confidentiality. So they removed Sarah out of the situation while they did their investigation, and then as a part of her return, she had to go through, additional training and support so that she understood, how, her actions impacted that patient's privacy, but then also how she could improve in the future. From the organizational perspective, they did face potential fines from regulatory bodies due to the breach. And so they had to notify Mr. Thompson and his family about the breach, explaining the steps that they were taking to address the situation and protect patient information moving forward. So we have to take these things seriously, right? And so it's not something that it's okay, well, let's just be aware of it and rectify it. We have to have a formal process to make sure that we're meeting those patients' rights, and this is a condition of our participation with Medicare and Medicaid. For the patient, Mr. Thompson felt a loss of trust in his providers, leading to an increase in anxiety about his confidentiality and his personal health information. So, despite reassurance and improved privacy measures from the agency, Mr. Thompson requested a different home health aide for future visits, right? So, that patient had the right to be able to ask for a caregiver change so that he could feel more confident and secure in how he was working with this staff. So lessons learned here are making sure that our staff are aware of what their role is in promoting patient privacy through training, making sure they understand and that our policies address these, making sure that we have a reporting system so that we can, follow up on those concerns around data breaches or health information being shared and breached in inappropriate ways, and then enhancing communication protocols. So we want to make sure that we're preventing future breaches and that we have an organizational approach to, and guidelines for secure messaging and encouraging staff to avoid discussion. So here in this case, Sarah was sharing information about a patient peers to another team member, her friend heard, and then this person on the bus that happened to know as well. So, it just really kind of snowballed into a situation that shouldn't have happened if there were secure measures in place. So, this really kind of demonstrates how just a seemingly innocent conversation can lead to a breach in a home care context. And it also just really is a reminder to all of us that, to be aware where we're communicating about patients, how we need to be aware of what our protocols and policies are, and then what we need to be able to do to assure to our patients that we're following those things. So key points, you want to make sure you understand HIPAA, know the basics, participate in your organization's training requirements, ask for more training if you feel like you need more information to be able to be more confident. It's also an evidence-based practice to use scenario-based training to help, apply examples so that people can take all this information and, apply it to something that's meaningful in the work and the context that they're doing their work. Use secure communication platforms. Don't be casual about, how you're sharing information, where you're sharing information, on what devices you're sharing your information. You want to be really secure. Keep those records protected. Make sure that when you're going into your patient homes, be thinking about where and how you're interacting with patient, who those patient approved members of their family are that can receive information. Like, know that information up front, and always err on the side of um, you know, safety and protection for the patient if you're not 100% sure, right? And acknowledge that. Maybe, just say, let me be sure that I can share this with you before we move forward. Always err on the side of extreme safety so you're not oversharing. And then make sure that we have all those documentation pieces in place, the consent forms, the signed consents, anything that needs to be updated, who we can share that information with. Our records need to be, clean, right? Make sure that you have a process for reporting and responding to breaches. So all the way down from in the field, if staff are identifying opportunities there, and then what and how they complete those incident reports to report those breaches, and then at the organizational level, making sure that we're monitoring for compliance to the policies that we have in place, and staff are aware of them, and where we stand with being able to, um, you know, fully carry out the expectations that we have in our policies. Do we have opportunities for improvement so that we can self-identify them early before there are any data breaches? So again, just in conclusion, protecting patient privacy and adhering to HIPAA regulations is crucial, not only to maintain trust with our patients, ensure quality care, and avoid consequences. And so, as staff, if we want to be, aware of these key points, we'll be, contributing to, a culture of confidentiality and security in our challenging patient environments, right? So we're all responsible for assuring that patient safety. Patient confidentiality. I've provided some resources here in terms of the content related to this. Again, as leaders in an organization, being aware of what the current recommendations are is important because things do change, right? So you want to have the most up-to-date information and assure that your policies are addressing those as if there are any changes that need to be made. So thank you, and thank you for your time, and have a great rest of your day.